السلام عليكم.
وعليكم السلام ورحمة
وعليكم
الله
السلام.
وبركاته.
Okay, guys, today, inshallah, we will finish Breaking Bad News, difficult referral, and we can take some stations of conflict. If we cannot, so tomorrow we can finish conflict and complaint resolution. Okay, so today and tomorrow we will finish all teaching decisions, and then we will go for mock exams till the exam dates. Um, complex, challenging situation, complex, challenging situation, two stations in the exam. It could be more. So sometimes they are changing the structure of the uh, exam. So again, the most important domain in the exam, clinical reason decision making. What will you do with the actor? I mean, with the patient. So management plan. So management plan in history or in examination or in any communication, for example, Breaking Bad News, what will you say to the patient? The decision, okay? In conflict or in complaint, what is your decision? What will you do with that? Communication skills, your attitude inside the room, like rapport, empathy, sympathy, and comfortability, being give information in bases or questions in bases, check understanding, closing between bases, like that. Okay, good eye contact as well. The third important domain, organization, prioritization skills should be organized in all stations. We finished the history, psychiatry, and resuscitation, practical skills teaching, examination, and inshallah today and tomorrow we will finish communication skills. We almost finished 40 batches for online and face-to-face courses. So once we finish the teaching session, we will go for mock exams. We will try to make daily mock exams. Accuracy, the most important domain here. So it means the checklist. You should mention all the points in the checklist. Skillfulness, you should be fluent. And supportiveness means your attitude. And visual structure, you should be organized. Safety, you should cover the safety points. We have for practice Marwan, Fatima, Samodo, Al-Khansa, Fatima Safana, and Ahmed Magdi. Okay, so Breaking Bad News, it could be died already, or the patient is still alive but will not survive. If they mention will not survive, you will mention will not survive. If they mention die, you will mention died. Don't change words. So if they said will not survive, please don't change. Don't say he's going to die. Okay, so don't change the words. Serious diagnosis like what? Like for example, the patient has C4 fracture or C5 fracture, like that. Okay. Okay, so we have here for breaking bad news, drowning. Already the patient died, so you should uh, mention some points. We will inform you now. Cerebral palsy died, RTA died, meningococcal septicemia died. Um, Here you have to follow the general approach. Number one, your attitude will be calm. You, as candidate, you should be calm, okay? And your tone should be slow. The pressure of speech should be low. Don't be fast. Don't rush in time. Don't raise your voice, okay? So once you go inside the room, once you go inside the room, you are standing and you will find the examiner, you will find the actor. So just pretend you put your hand in front of your chest like you are turning off the phone. Even you don't have phone, just pretend. You can verbalize good morning. Don't look at the examiner or the actor. Just say good morning and ignore both of them. Then verbalize, I will turn off my phone. I will hand over the department to senior colleague. We are in private room, one nurse with us, and I will check the notes. Then the examiner will give you the notes, sometimes one paper, sometimes half paper, sometimes two or three papers. So you should read carefully. And when you are reading, I want you to whisper. Even you are not reading fully, but at least show the examiner that you are reading the paper carefully. Read by your eyes, by your fingers, okay? And show sadness. I want the examiner to see your face, sadness, okay? The camera to show your sadness also, okay? So once you read the paper, focus on the most important events. For example, the name of the patient. If you remember, okay, if you don't, it's not a big issue. At least the events, I mean, what happened? Is it RTA? Is it chest pain? Is it infection like meningitis? What happened? And the patient admitted to ICU or an ER or now or last night, okay, or what? And the events. So what happened? For example, he collapsed last night and he was admitted in ITU. After that, cardiac arrest. After that, resuscitation. So what happened? Just put in your mind, like for example, 7 events, 7 steps. Okay, no need to memorize all the papers, but at least the events. So what to say to the actor? Okay, for example, is it drowning? Is it cerebral palsy? Is it RTA? Is it septicemia? The exam will be repeated. They will not give you any new station. So you have only these diagnoses. Okay. So remember any of them and the steps as well, the evidence. Okay. So after you read the paper, you will sit in front of the actor and verbalize to the examiner, I will approach the actor. Sorry, I will approach the patient, not to say the actor. Okay, I will approach the patient. Then you can greet the patient, good morning, and Dr. blah, 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 blah. One of the ED senior. May I know your name and relationship with the patient? Sometimes the patient will be disappointed or angry or shouting, where is my blah, 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 blah. Please be calm. So you should calm the patient first, and you should be calm also. So please be calm. I am here to discuss with you the condition of your son. or your husband or your wife, like that. Okay. Then how much do you know so far about your son or husband or wife? Okay. So now you will start the station. You have short, short, shot, short shot. Then the patient will cry. Then you will offer tissue and water. And then you will go for second shot. The first shot should be very concise, very concise. Like what? Drowning, for example. I'm sorry, your son wrote after drowning, his heart stopped beating, and I'm sorry, he died. Done. So the word died. Number two, the word heart not beating. Number three, drowning. More than enough. 3 points. Clear until here, guys?
Yes.
Yes.
So
Yes.
don't explain in the beginning. No need. Why? Because I want the actor or the patient, even in real practice, to understand the patient died. I don't want to say any other words. I want him to hear clearly died. Okay? Then he will cry, or maybe sometimes he will not cry. Sometimes in the exam, he will not cry. He will just look at your eyes. Good eye contact will give you marks from the beginning to the end of the station. In any station, you have 16 stations, your eyes in the eyes of the actor. Whatever, history, examination, um, breaking bad news, good eye contact will give you good marks, especially in this station. The actor will cry and looking down, you should look at his eyes. The actor is silent, you should look at his eyes. Okay? When you finish the word died or the word will not survive, don't talk for 10 seconds. Don't talk at all. And don't offer tissue, don't offer anything. Be silent. Just look at his eyes. Once he finish crying, after 10 seconds, or even he did not cry, so after 10 seconds, you will offer tissue and water. Only, don't talk. So you will say some tissue, some water, and don't talk. Okay? Then pause again for 5 seconds. Silence will give you marks. Silence will give you marks. Don't think if you talk too much, you will get marks. No, this will decrease your marks. Okay, so after you offer tissue, after you offer water, whatever he cried or not, then you will go for support. Support here you have many points. Number one, support regarding relatives. So you can say, would you like to call anyone, relatives or friends? Number one. If she said yes, okay, I will arrange for you. I will ask one of our colleagues to arrange for that. Okay. The second point, any children at home? If yes, it's not a big issue. You should ask, anyone care about them? If yes, ignore the issue. If she said no, so I will arrange with social services. They will bring them to you. Okay. So this number two. Number three, if the problem unknown reason, for example, drowning, you should involve a coroner. RTA, you should involve a coroner because you don't know the reason. So you can say, I know it's a difficult situation for you, and he was in drowning. We don't know um, What are the reasons behind that? So we should involve the corona. Is that okay with you? Like that. Okay. The fourth point, you will ask about religious beliefs directly. Do you have any religious beliefs? If she said no, ignore the issue. If she said yes, okay, we will involve your religious minister for you. Okay, the next point, you will ask about organ donation. The new rule, the new rule in the UK, if you check the NHS website for organ donation, you have registration for organ donation or registration to not donate. So don't talk about the organ donation itself. No, I want you to focus on the registration. So you can say, did your husband register to donate or register to not donate? Like that. Okay. For example, the son is 7 years. So you can say, did you or your husband register to donate for your son or register to not donate? If she said yes or no, or I am not sure, so you can say, okay, I will discuss with a specialist nurse of organ donation. They will contact you and discuss with you regarding this issue. Done. Clear until here, guys?
Yes, sir.
Okay. This is station very easy, and you can get 10 marks easily because it's a fixed approach. No need to think at all. Just follow the points. Okay, so the next point you will discuss about touch and see. Two words, touch and see. So you can say, would you like to touch your son and see him? Like that. Okay. If she said yes, so okay, give us time to clean the area. No need to say, we will remove tubes, blah, 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 blah. That's not a big issue. So just verbalize, okay, give us time to clean the area for you. Okay. Then after that, you can talk about papers. If the patient died, of course you will talk about papers. If the patient will not survive, also you can talk about papers. Okay. So even the patient will not survive, you will talk about organ donation. Yes. One of the indications, whatever in SBA exam or in Osce exam, even in final exam, I mean, whatever Osce or final SBA, you should understand that one of the indications to contact is not mean specialist nurse of organ donation is the patient will not survive. Okay. So if the patient will not survive, you should involve a specialist nurse of organ donation, and therefore you have to prepare papers. Okay. So now we finished all the points. Okay. Difficult referral, you will follow the approach of ice bar. We will discuss now after that. Regarding angry patient or relative, so conflict, the patient request or refuse management against the guidelines, you will follow introduction. You can write, guys. Number one, introduction. Number two, ice. Number three, brief data. Number four, management. Complaint, you will follow the approach of number one, introduction. Number two, ice. Number three, medical aspect. Number four, legal aspect. Okay. Counseling and advice, it will be history taking. So PEPS, post-exposure prophylaxis after sexual intercourse, it will be history taking, sexual history taking, like any sexual history. Bib after needle stick injury, it will be history. But history here, the present history will be about 3 points. History of the event, history of the recipient, history of the donor. Or we can say history of the donor first, and then history of the recipient. Then brief history, general approach. Blood splash will be the same. Pregnant mother and a child with chickenpox, it will be history taking. Okay. Okay, we will talk about that later. So, Marwan,
Yes, sir.
yes. So, the first station of drowning, they will not write in the pie chart like that. They will not say child died drowned. No, they will give you scenario and then task and then pie chart. So, sometimes they will mention here conflict resolution or uh, communication, management plan, sometimes the communication only. They will give you one domain communication. Clear?
Yes, sir.
Okay. So your task here explains the situation to the mother and answer any question she may have. They said here you have 1 minute inside the room to read the notes because some doctors they forgot to ask about notes. Okay. They said 1 minute. Even if you want to read within 30 seconds, it's not a big issue, but at least show the examiner that you are reading carefully. I will give you the notes verbal, okay?
Yes, sir.
So Parsons is a 7 years and brought by ambulance after drowning. He was presented with cardiac arrest. He was connected to the monitor by you. You were one of the team member. You moved the patient to resuscitation, and the rhythm was asystole. You tried to resuscitate the patient for 40 minutes. You called all specialties, and the patient died. Explain the situation to the master.
Okay, sir.
15 seconds to prepare yourself, and then 6 minutes.
Shall I start?
Okay.
Good morning. I will turn my phone and turn off my bleep. I will hand over my department to my senior colleague. Make sure that my department is safe. One of the nurse with me and relative is in the private room. So now I read the notes. Person 77 years old, or 20. Sometimes friend is drowning. Is present system. Okay, this time. Okay, now I will approach to the patient. Hello, I'm Dr. Marwan, ED registrar. May I know your name and relationship with person?
Where is my son? Where is my son, doctor?
Okay, please be calm. I'm here to explain you the situation. Okay, so how much do you know so far about person condition?
Yes, they told me he was in drowning. What about him now?
Okay, I'm so sorry to hear that. I'm very sorry that I have bad news for you. Your son presented with drowning and his heart is not beating. Unfortunately, he's died. Have some tissue, have some water. Would you like? Okay, your son brought by ambulance as a drowning, and heart is not beating and not beating, and immediately we shift station room, connect with the monitor, and involve all the specialty. We did heart massage for 30 minutes. We give all the medication and insert tube in the airway, but which is not help him to breathe. But unfortunately, your son is died. I'm sorry to hear that. Do you want to call anyone? Okay. Do you have any children at home? Anyone take care of him? All right.
Yes, my son is in America now.
Anyone take care of him?
I don't find his contact details.
Okay, I will ask social service to bring him contact with them.
How you will know that?
Do you have any address? Any contact person who can contact with him?
I don't know.
Okay, all right. So we will find out and call for social service to manage his contact. So I know this is very difficult situation for you. I'm here to support you. Okay. So do you have any special arrangement or any religious belief? Okay. In such a case, we involve the because we don't know what are the is drowning. Maybe someone. So for this case, we want to involve the coroner. Would you like to see your child or touch your child?
Yes, please.
Okay. So, but let me give some time to clean the area. Okay. So, does you or your husband registered your son for organ donation?
I'm not sure.
Okay. So we will contact with our senior SNOD for this purpose. They will communicate with you and we will help you. All right. I know this is very tough time for you, and I'm very sorry for your loss. And I'm here to support you. Now I will let you know that you can see your child and you can touch your son also. I will help you with the bereavement office and arrange the funeral. Is it all right? Do you have any other question?
Okay.
Okay, I'm here all day in the department. If you have any other question, anytime you can call on, you can ask any question regarding your son issue. I'll be more helpful
It's my
to.
fault. It's my fault.
No,
He asked me to go to play with his friends. I let him to go.
no, because this is not your fault. Don't blame you because this is an accident. This is not about your fault. It's happened sometimes. It's accidentally. So there is nothing on your hand. Don't worry. I know this is very big loss for you. Do you have any other question?
Okay. Excellent, Marwan. Thank you. We still have 30 seconds. Okay.
Thank you, sir.
So already you finished and you still have 30 seconds. In the exam, you will find the further 2 minutes because we are practicing within 6 minutes in the exam, 8 minutes. So you don't find any problem in time management, right? So I want you to give pauses between points. Clear?
Okay, sir.
Try to give pauses between points. Your voice good, the tone is low, and the pressure of speech low, good. Um, I wish you will be with good eye contact, but I think you did very well. So I will give you 10 out of 10. Thank you.
Thank you, sir.
Well done. So already all the points covered. Introduction, first shot, then the patient was crying, then he was silent, then after the patient finished crying, then he started to offer tissue and water, and then he was silent again, then he gives a second shot explanation, and then the points of support. So he covers the point of calling any relative, then ask about children. Even I don't have the contact details, but of course, the social services, they will find a way. Okay. Regarding the next point for coroner, next point for touch and see, next point of registration, and uh, next point of papers. So all these points very, very important. Okay, well done. Fatima, Resania?
Yes, sir.
Yes. Okay, so the next station will go for cerebral palsy. What are the contraindications? So we have absolute contraindications and relative contraindication. Okay, so HIV and CGD, they are absolute contraindications. Okay, but other indications you can consider as relative. So if this patient cerebral palsy and he has, for example, meningococcal septicemia, so it's not absolute contraindication. So if the actor said, my son or my wife has infection, if the actor said, if the actor said, I have my wife or my son meningococcal septicemia or infection or organ failure, anything like that, it's a relative contraindications.
Okay.
Okay. So what is your answer or how to formulate good answer for that? So you can say, I appreciate your concern. We can contact, you can say it's a relative contraindication to donate, but we will contact the specialist nurse of organ donation. They will discuss with you regarding this issue. Clear this point, guys?
Yes, sir.
Okay. So I will give you the notes verbal. Okay.
Okay, sir.
So Jack is 1 year old child who has been admitted in ITU after fits last night, and he has history of cerebral palsy. He was intubated and ventilated. His brain CT scan was showing um, infection, encephalitis, and uh, today he deteriorated. He was in critical condition. His blood pressure is uh, inaudible, and saturation is not reading. His heart stopped beating, and your team did resuscitation for 40 minutes. The monitor was showing asystole, and he died. Okay,
Okay, sir.
so explain the situation to the mother. You have 30 seconds and 6 minutes. You can start.
Okay. Good morning. My phone is switched off and my BP is off. My department is in safe hand, and I'm in a private room with one nurse attending me, with me. To be fully aware about the patient, I'm going to read the notes. Check it. Okay, now I'm approaching the patient. Hello, I'm Dr. Fatima, ED registrar. May I know your name and the relationship with the baby?
Yes, where is my son? Where is my son, doctor? Is okay.
Okay. Please be calm. We are here to help you and support you. Please have a seat. Before we start, can I offer you a drink or anything else? I'm going to explain you about your child. What do you know about your son's condition so far?
Yes, he has cerebral palsy and he has fits last night and he was admitted in ITU. What about him now?
Yes, actually, he came after a fit and admitted to the ITU. But today, morning he got arrested. His heart didn't beat, and we resuscitated him, but he died. I'm sorry to say that. Okay. Do you want tissue? Have some water. Are you okay now? I'm really sorry for you about today. Did you understand what I have said? Do you want me to explain more? Your child was brought by yesterday to ITU following a fit, and he was in critical condition. Therefore, we have put a pipe into his lungs, and because he's not responding, we did a CT, and it confirmed that there is infection in his brain. And unfortunately, today morning he deteriorated. Our team tried our maximum to bring his life back. His blood pressure did not come, and his saturation was dropping drastically, and his heart stopped beating. And then we resuscitated him. We gave chest compression for about 40 minutes, and unfortunately, we could not bring him back, so he died. I'm really sorry about that. Do you want to call anyone?
Yes, call my husband.
Okay, I will talk with our colleague to arrange for it. Do you have any children at home?
Yes, my son is in Turkey now, but I don't have his contact details.
Okay, we will arrange social services support to find contact about your son and make sure he's safe and bring him here. And do you have any religious beliefs?
No,
Okay. Uh, so regarding this, did you or your husband register your son for the organ donation register, whether to donate or not to donate? I'm sorry for asking this question. We have to ask this question from everybody. Have
I'm
you
not,
registered?
I'm not sure.
Okay. Anyhow,
So
this is a
he has
relative
he has
contraindication.
he has cerebral palsy. So do you think is this can donate?
I appreciate your concern, but this is a relative contraindication. But regarding this, to sort out this problem, I will we will inform the specialist nurse of organ donation. She will help us in finding this. Would you like to touch and see your son? Okay. Let us clean the area, and we will let you touch your son. Meanwhile, I will help you to do the all document work and paperwork. Uh, do you have any immediate question for me? Do you understand so far? Anything which I can help you further?
I know it's my fault. I should bring him 1 week earlier. He was he was unwell, but I thought he would be okay.
Don't feel guilty about that. It's a very difficult situation. I know we are sorry to um, about your situation, but don't feel guilty. He came with a fit and his condition deteriorated. That happens sometimes. You should not feel guilty about that. We are here to
Okay,
support
thank you,
you.
Fatima. Thank you. You did well. Okay.
Thank
Um, so the general approach is very good. You're not fast, and your voice also, the pressure of your speech not high. Good. So I think your attitude is suitable for this station, Breaking Bad News. You covered almost all the points. So introduction, first shot, then patient is crying, you were silent, and after finished crying, you offered tissue and water. After that, the second shot, detailed explanation. Then you jump to support points. Okay. Regarding cerebral palsy, it's a not relative contraindication. No need to mention about cerebral palsy if contraindicated or not. Okay. Because it's not mentioned
Okay.
in the contraindications. Okay. So you can say, I appreciate your concern. We can uh, contact the specialist nurse of organ donation. They will discuss with you regarding this issue. More than. But if she said about organ failure or anything like that, okay, or infection or malignancy or anything like that, so you can say it's a relative contraindication. Like, and then you will mention the C. Okay, so well done. I will give you 10 out of 10. Thank you. So model,
Thanks.
So I will skip my turn for now. I'm still traveling.
okay. Al-Khansa,
السلام عليكم دكتور هاني.
alaikum assalam. Okay, we will try, uh, will not survive. So I think RTA will be the same issue, right? Because died already, so we can skip to save time. We can go for any station will not survive. This station sometimes it come also. So fetus died, it could come as breaking bad news and sometimes as history. So if they mention here history, you will take history. If they did not mention history, so it will be breaking bad news only. So you can do this station, okay?
Okay.
Do you want me to give you idea?
Yes, please.
Okay, so if they said that in the scenario, the mother, she has vaginal bleeding, and then the ultrasound showed dead fetus or no heartbeat or anything like that. Then in the scenario, in the task, explain the situation. So it means breaking bad news. So you will follow the general approach. You will go inside the room. You are standing, then verbalize good morning to the actor and to the examiner. Don't look at them, ignore them. Then verbalize, I will turn off my phone and I will be in private room, hand it over my department to senior colleague who will nurse with me. I will check the notes and then you will read the notes. Okay? Then you will approach the mother. Also, you will follow the general approach. So, introduction, good morning, and blah, 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 blah. May I know your name and age here because no relation to patient. There is no patient. Only the actor is the patient. Okay? So, you can say, May I know your name and age? Don't say and relationship. Then, nice to meet you, Robert. And then, how can I help you? Or you can say, um, I'm here to discuss with you the condition and the report of the ultrasound scan of your tummy. Clear?
Yes.
You have any approach. You can say, how can I help you? Or you can say, I am here to explain the condition of and the report of your tummy. Okay. And also, if you want to add your womb, it's okay. Then, how much do you know so far about your condition? Okay. Then you will give here the diagnosis very early. Okay. You can say, I'm sorry, I have bad news for you. The ultrasound scan of your tummy and your womb shows dead fetus. And then stop. Okay.
Yes.
Then after the patient finish crying or whatever, maybe she's not crying, she's looking at your eyes. Then you can say some tissue, some water. After that, you can explain to her more. Okay. Or you can ask her about some brief data. Okay. Sometimes the actor will tell you the data in the beginning. For example, if you say, how can I help you? She will say, I have vaginal bleeding last night and blah, 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 blah. Okay. So don't go through history before telling her about the dead fetus. I want you to mention the dead fetus very early. Clear?
Yes.
And you can take data after she cried, after you offer tissue and water. Why? You have time to take data, but you should inform her first. Okay. So after you finish tissue and water, then you don't have information to mention. You don't have information to mention. If they give you information and the notes, you can give her the information. Clear now? Okay. So I will give you the notes verbal. Mrs. Hadil, 28 years, old female, G1B0, 13 weeks gestation, seen today at clinic for ultrasound results. She has been having some vaginal bleeding last night. She fell from stairs, last two stairs, and she has no other injuries. But after that, she has some vaginal bleeding, which stopped after 10 minutes. Okay. She used only one bed and vitally stable and no pain or medical problems at the moment. The ultrasound scan shows dead fetus. She's unaware of the results of the ultrasound scan and hoping that everything is all right with pregnancy as it is very much wanted. This is the first pregnancy and it was in vitro fertilization. Clear?
Oh, sorry, Dr. Hani, you mean I should take a little bit history?
After the second shot.
Yeah.
Okay.
Okay.
So after the second shot, you will take some data. Okay. You will confirm with her about the pregnancy and so on. So if mentioned in the note about in vitro fertilization, you can say, I have been informed that this pregnancy was in vitro fertilization. Is that right? What if they did not mention that in the notes? So you can ask her clearly. Clear? You can ask her what is
Yes.
the type of conception? Is it natural or in vitro fertilization? Okay. So anything you mention in the note, you can say, I have been informed that blah, 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 blah. Okay. After you finish taking data, okay, then you will go for support. Would you like to call anyone? But if this is the first pregnancy, don't ask here any children at home, not logic. Clear?
Yes.
And regarding the point of coroner, not applicable here. And regarding the point you want to see and touch your baby, not applicable here. Okay. Regarding the point of organ donation, not applicable here. Okay. So support here, only one point. Would you like to call anyone? Okay. And then support for the management plan. What is the decision? What you will do now? So of course you have three options. Okay. Then three options here. It could be conservative or medical or surgical. So you will call Ops and the gyne team. They will support here and they will share the decision with her. Clear? Okay. You have
Yes.
30 seconds and 6 minutes. Okay, can I start?
Hello. I hand over my patient to my colleague and turn off my clip and phone. And I am in private room and one nurse attend with me and I will read the note. Okay. Hello, I'm Dr. Kansa, one of ED doctor. May I confirm your name and age, please?
Yeah, I'm Hadil. I'm 28 years.
Nice to meet you, Mrs. Hadil. How can I help you today?
Yes, doctor. So what about my report?
Okay. Are you comfortable, Mrs. Hadil? Do you have any pain?
No, it's okay.
Okay. How much do you know so far about uh, your condition, Mrs. Hadil?
Yeah, I have some vaginal bleeding last night. I came here to check the fetus, my baby.
Yeah. I am sorry, Mrs. Hadil. I am here to discuss with you regarding your ultrasound, and I am sorry. I have bad news for you. That ultrasound showing that your baby have heartbeat is no heartbeat, and the baby dead. This is tissue and water. Mrs. Adil, I am here to support you. And I'm sorry for that. Can you tell me more about what happened?
Yes, please.
Okay. Do you want to call anyone, Mrs. Adil?
Yes, call my husband.
Okay, I will arrange for that. Mrs. Adil, what happened exactly for you?
Yeah, I fell from stairs last night. After that, I have vaginal bleeding.
Okay, I'm sorry for you to hear that. It is your vaginal bleeding starting suddenly after failing, yeah, and at night, yes. It is fresh or color or there is clot.
Was fresh.
Okay. And did you have this problem before or this first time for you?
First time.
Okay, and now bleeding stop or still there is bleeding?
No more bleeding.
Okay, sorry for that. Are you, do you have any past medical disease?
No.
Any previous surgery?
Yes, I did in vitro fertilization.
When you did that for this baby? And do you have any prescribed medication?
Yes, they gave me medicine to support the baby.
Okay. And do you have any allergy?
No.
Okay. Where do you live? When with whom?
Was my husband.
Any sorry for that. Are you drink alcohol or smoke?
No.
Do you are you use any illicit drug?
Okay, your time done. Thank you. Okay, excellent, Al-Khamsa. But no need to ask about these questions, okay?
Yeah.
They did not mention here history taking. So if you want to take brief data for the most important points, okay?
Yes.
They did not say history taking. So if you want to take brief data, because communication skills, this is open domain. Communication skills, open domain. I mean, you can take data, no worries. Communication means you will communicate with the actor. You will talk with the actor, talk in anything. Clear?
Yes.
Okay, so if you want to take data, something relevant to the problem. So
Problem. Yes.
if you want to ask any past medical disease or any previous surgery, okay. But regarding smoking or it's
Yeah.
not issue here, and it will be annoying. So already they mentioned G1B0, so you should inform here. Already I give you the notes, verbal, about in vitro fertilization, so you should inform here. If you will ask the actor to explore information, the examiner will think you did not read the notes. Did you get my point?
Yes. So good.
So is it logic to ask here what is the result in your ultrasound?
No.
Not logic. You should inform me here about the result. So is it logic to ask here how many weeks for your gestation?
No.
Not logic, because already it's mentioned in the scenario and mentioned in the notes. So if you ask the actor about anything written in the scenario or anything written in the notes, it means you did not read carefully.
Understand. Yeah.
Clear now?
Yes.
Okay. So if you want to ask about something not written in the scenario, not written in the notes, and should be very concise, very, very relevant to the station. Clear?
Yes.
Okay.
Clear.
You did well. So you did not reach the end of the task. So
Yes.
if instead of asking about smoking or illicit drugs or alcohol or anything like that, you will go for management plan.
Yes.
So you will ask here, what is your concern now? Because any management plan should be preceded by concern. In any
Yes.
situation, if you want to discuss about management plan, you should ask about concern first. Okay? So you can ask
Yes.
here, I know it's a difficult situation for you, and I'm
Mm.
really sorry that this happened for you. So what is your concern now? You can tell her like that. Then you will give her the management plan. So I will contact the Ops and Gain team. They will give you options to choose, blah, 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 blah. And they will share the decision with you. Clear now?
Yes.
Okay. So I will give you 8 out of 10 because you did not mention the management plan and you did not ask about the concept. Thank you.
Thank you.
Fatima Safana?
Yes, sir.
Okay, we will go for any station will not survive, like this station, for example. Okay?
Okay.
So the approach will be the same. So patient will not survive, it's an indication to involve a specialist nurse of organ donation. And of course, if you involve organ donation, it means you have to prepare papers also. Okay? So I will give you the notes verbal. Okay? Okay, doctor?
Okay.
Your voice not clear.
So can you hear me, sir?
I can hear you, but your voice not clear. So when you are talking in online session, please, or in the exam, try to make your voice clear, your accent clear also, okay?
Okay.
John is 69-year-old, brought to ED by ambulance after collapse, and he was in coma. His GCS 3 out of 15. He was intubated and ventilated. His vital signs was normal. The brain CT scan was showing massive subarachnoid hemorrhage with midline shift. The CT scan result and imaging reviewed by consultant neurosurgeon who said it's not operable and he will not survive because of massive intracerebral bleed and subarachnoid hemorrhage. And he said he should be made comfortable. Explain the situation for his wife. Okay. So you have 30 seconds and 60 minutes, and they will show you the CT scan in the station. Okay.
Okay.
So you have 30 seconds and 60 minutes. You can start.
Good morning. I will switch off my leaf and switch off my phone. I will hand over my patient to my colleague and ensure the department is safe. And I ensure the room is silent and I have a nurse attending with me. And I will read the note. Okay, I will approach the presentation. Good afternoon, I'm Dr. Safana, Video Registrar. May I know your name and relationship with the zones, please?
Yes, where is my husband now? Is he okay, doctor?
Calm down. Please sit that. Need to share about
Your
your
voice not
husband.
clear, doctor. Your voice not clear.
Please be calm down. I am here to explain about your husband. Can we move to the private room, please? Please have a seat. Can I tell
Please.
you something?
Wait, please, doctor. Guys, can you hear clearly?
We can hear you very
No,
good.
not
Okay.
Try to fix Safana, please. I don't know because of the mic or because you are not fixing anything. I don't know. I care about the exam also. You should be clear in the exam.
Can you hear me, sir, now?
Okay.
I start from the beginning.
No, you can continue now.
Please be calm down. Can we move to the private room, please? I'm here to explain about your husband condition. So, first of all, shall I offer you some drink? Okay, so how far do you know about your husband? Hello?
Yes, my husband, he was collapsed last night. So what happened, doctor?
Yeah. Yeah, we was brought to the emergency department with very low GCS. So I have a very bad news to tell you today. So he was having a large bleed into his brain, and our neurosurgeon has seen and he has said he will not survive. Let me offer you some tissue and water. Okay, you understand what I said so far? Do you want me to explain more? Okay, your husband got collapse, and when we found he was not responding, and we immediately transferred him to the resuscitation room. We intubated, we put a tube into his mouth, and we gave breathing. And his conscious is very low. We did CT, and we saw there is a very large blood inside the brain. And do you want to see the CT scan? You see this white area is the bone, and this gray area is the brain tissue. And you see this large white area is the bleeding inside the brain. You can see this blood is compressing the brain material. So our neurosurgeon has seen, and he said this is not operable, and he said he's not going to survive. Do you want to call for anyone?
Yes, call my brother.
Okay, I will arrange with my colleagues. So, do you have any children at home?
Yes, my son is at home now.
Okay. Anybody caring about him?
No,
Okay, I will arrange with the social service and I will ask them to bring him here. Okay. So, do you have any religious beliefs?
no.
So, these situations we ask in a lot of normal patients. So, has your husband registered for organ donation?
I'm not sure, doctor.
Okay.
Thank
So
you.
you know that.
Thank you. Your time done.
Okay.
Okay, I will give you 30 seconds. You can continue.
Okay, we can. As this is a brain hemorrhage, we can ask a specialist nurse for organ donation to talk with you regarding this. As a lot of people are waiting for the organ donation. So you want to touch your husband?
Yes, please.
Okay, let me arrange for that. So I can make the area not frightening for you. So you can see your husband and touch. So, and meanwhile, I can talk with the bereavement office for the paperwork and everything. So,
Okay, thank you. Thank you.
Okay.
Thank you. Okay, well done. Okay, you are doing very well. I know maybe something wrong in your mic, but anyway, you are perfect. Thank you. So
Thank
you follow the general approach and introduction done regarding the first question done. Then you offer support. The first shot, then the patient or the relative was crying, then you were silent. After that, you offer tissue and water, and then you explained the details. You try to offer to show the imaging, and you explained the imaging. After that, you finished all the points of support. So I will give you 10 out of 10. Thank you.
Thank you.
Well done. Okay. Ahmed Magdi.
Yes, Dr. Hani, Assalamu alaikum.
Alaikum salam. How are you?
I'm fine, alhamdulillah. How are you, Doctor?
Alhamdulillah. Okay, we will try. So we finished a station for diet, and then some stations for will not survive. Then we will go for something serious, like for example, fracture of C 4 or 5. Okay.
Okay, yes.
Do you want me to give you idea?
Yes, please, Doctor.
Okay, it will be the same as general approach. So you will be standing, just to say good morning to the actor and the examiner. No need to look at them. Just when you are going inside the room, say good morning. And you are standing, then verbalize, I will turn off my phone, my bleep, blah, 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 blah. The same introduction. Then you will check the notes. Sometimes they will give you notes like one paper or two papers or whatever. So I will give you verbal now. And here you will give him very, very concise shot. So in the beginning, you will say, of course, you are sitting now after the introduction. Then you will say, I will approach the patient relative. Okay. I will approach the patient relative. Then you'll say, good morning, I'm Dr. Blah, blah. May I know your name and the relationship with blah, blah, blah. Nice to meet you, Robert. And then you will say how much I'm here to explain the condition for you. How much do you know so far about your husband? She will say, if she is not calm, you should calm her. If she is calm and she said anything, yes, he was in road traffic accident and he has neck fracture. And
Yes.
I have bad news for you. He has paralysis of all limbs. Okay,
Mm.
so the breaking bad news here, what?
About the paralysis of four limbs.
Yes. So in station of died, so the breaking bad news is died. You should mention died. In the station of will not survive, you should mention will not survive. Will not
Yes.
survive. Here the breaking bad news, not C4 fracture. It's not breaking bad news. Okay, because she will think C4 fracture like finger fracture. Clear?
Yes. Yes, clear.
So the breaking bad news should be the big issue. Okay, so the big issue here, not the C4 fracture. Sometimes the patients they have C4 fracture without paralysis, no spinal cord injury. I mean,
Yeah.
okay. So you can say, I'm sorry, I have bad news for you. Your husband was in a road traffic accident. He has neck fracture, and this cause paralysis of the forelimbs. And stop. She will cry or not. You will wait for 10 seconds, and then some tissue, some water, and be silent. Don't talk. Then you will offer explanation. So I will give you the notes verbal, okay? So Mr.
Okay,
Jack
doctor.
is 37 years, brought to ED by ambulance after road traffic accident,
Yes.
has a fracture in the neck and other multiple injuries. Other injuries stabilized, injury in the chest stabilized, and is okay now. And regarding the abdomen, some contusions, but no free fluid. And the neck fracture after CT scan and MRI and reviewed by neurosurgical consultant, it's showing C4 fracture and causing compression in the spinal cord. And this his affect his uh, breathing. That's why he was intubated and ventilated. Okay. He has paralysis in the arms, hands, trunk, and the legs. He's
Yes.
unable to speak. Okay.
Yes.
And he requires complete assistance with activities of daily living, eating, dressing, bathing, and getting in out of bed. Okay.
Yes. Okay, doctor.
So explain the situation to wife and answer any question she may have. So you have 30 seconds, then 6 minutes. In the exam, guys, sometimes they will give you C4 fracture or C5 fracture, but most common C4 because C4 is dangerous. Why? Because I want you to take screenshot from this slide, guys, please. So C1 to C4, remember these points. Whatever mentioned in the notes or not, at least you should memorize or at least uh, be familiar with like 4 or 5 points. Here also C5 to C8, you remember these points. Okay, so if they give you station any fracture from C1 or 2 or 3 or 4, remember that. If they give you station fracture of C5, 6, 7 or 8, remember that. Clear, Ahmed?
Yes, clear. Doctor, here his speech will be affected, huh?
Yes, of course.
Yes.
So in a way, follow the notes. Okay.
Okay.
So if they said in the notes the speech is slurred or affected or unable to speak or intubated or you should mention that clearly. Okay. If not mentioned in the notes, so talk in general. Okay. So, for example, they did not mention about um, uh, paralysis. So you can say, sorry, if they did not mention about breathing. So you can say, patient in such a case. So it means you are talking in general, not him. Okay? Patient
Yes.
in such a case, sometimes unable to breathe on his own, cough or control power or bladder movements. Easy?
Yes.
Okay. So
Okay.
you have 30 seconds and 6 minutes. So I will give you C4 fraction. Okay, can I start?
Yes, please. Good afternoon. I'm Dr. Ahmed, one of the ED doctor. I'm turning off my phone and bleep. I will hand over my department to my senior colleagues, and I'm in private room with a nurse to support us. I will read the notes. Oh, yeah, that's a bit- I will approach the relative. Good morning. I am Dr. Magdi. I'm here to discuss the case of Mr. John with you. Can I know your name and your relation with Mr. John?
Yeah, so what happened with my husband, doctor? He's okay?
Please be calm. I'm here to discuss the condition with you. Can you please have a seat? Do you need any drink? So, ma'am, how much do you know so far about the condition of Mr. Jack?
Yes, they said he has road traffic accident. I don't know what happened.
So what happened? Yes, he had a road traffic accident, and after coming to the emergency and the hospital and doing the investigation to him and the medical care, unfortunately, we discovered that he had a fracture in his neck, and this condition unfortunately affected his ability to move. He has a paralysis of 4 limbs. Sorry for that.